Thank you very much. I'd like to invite another person that I've had the pleasure of working with, Dr. Stewart. Now, Mark Stewart is one of these unsung heroes. So what happens with Mark is people don't recognize that you say, I need such and such. You won't hear from Mark, but you'll hear from his assistant who will say he may be in his lab, et cetera, et cetera. But the bottom line is that you get what you need. And so I want to thank him in advance for that. I've worked with him at the Brooklyn Health Disparities Center, and there's rarely a time when he says no. So welcome.
Just going to add a couple of points to what's going on so far that at least I've had the chance to hear. For those of you who don't know me, my name is Mark Stewart. I'm the Dean of the School of Graduate Studies here. I've had the pleasure of working with folks like Larry Schell, Jim Diaz, and others from the University of Albany. I joke with them that it's actually less time for me to commute from my home in New Jersey to Albany than it is here into Brooklyn. Sometimes I could drive to Albany and back in less time than it takes me to go one direction. Our friends at Medgar Evers, we've had a deepening relationship with that campus, and I'll say a couple of other things about that, but Dean Blackman is here and colleagues from the School of Biology. And Brooklyn College has had a long history of working with us. When we first started to dig into some of the details here, I mean, what you've heard from the trainees and others is that there's a sense of becoming a doctor, a nurse, a lawyer, an engineer. And that's a sense that comes from families that are raising these children, from the children's own experiences. There's a clear sense of where they're headed with certain educational issues. In fact, one of the programs that is expensive for us and something that we're proud of is our MD PhD program, where I basically pay you to go to school. That said, it takes you twice as long because you're doing both the full MD and a full PhD. And my issue is never, when we're recruiting, it's never with the student. My issue is with the parents of the student. Because those parents have an expectation that the student is going to finish their education and start working. They have extended and immediate family demands that are significant and in many cases substantially more than what a lot of our other students have to deal with. So it's a challenge. Even though I'm giving away an education for the highest degrees that you can obtain, they have pressures that really offset that. So part of the trick for us is understanding the why somebody wants to do research. There are a lot of reasons why, but we don't always explain that well. Anytime you hear a student that says, I didn't really know what I needed to do, that's our failure in terms of explaining the why. But we also need to understand the why nots, and there are substantial why nots for a lot of our students. Any chance that I get to talk about some of our experiences, I like that. I'll say one thing before we get to that. Research is really in the throes of essentially disappearing in some ways. Our own curriculum in the College of Medicine, out of necessity, because there's so much to do, has shifted further and further away from the foundations of medicine and more toward the practice of medicine. And so if you want to be somebody like Milena or the other resident, I'm sorry, I would just butcher your name and I apologize. If you want to be somebody like them, you recognize that you need a deeper foundation in the sciences than we've provided in the clinical training. So they understood the why, and then the trick is figuring out the why would they not do this. And it's really hard for them to do this additional work. And so it takes a village to put together the resources and guidance to help them accomplish what they're going to accomplish. But they'll be the future of medicine, and I think anything we can do to keep that going is good. I just got an email from someone, one of my students, a Medgar Evers student, that I love very much. Her name is Sophia Villiers. an email came to me asking for a reference for Sophia, and it was very simple. Is Sophia going to work hard? And so I wrote back, careful in what I said, but I said, Sophia's already, she's got 2 first author papers in press, and the 3rd one's been submitted. So I would say that, yeah, she's going to work hard. Sadly for me, I think she's taken to the Midwest. She's in Ohio, and that letter of recommendation went to Iowa. So I don't know. There's an attractiveness to the Midwest, especially if you've never been there before. So I think for us at Downstate, we have an opportunity to help the students that live here, the students that we have access to through these campuses like the University of Albany, Medgar Evers, and Brooklyn College, to really show them what we're able to give them guidance on. I mean, there are a lot of people here that have mentoring advice. But never forget that whenever we do things, a lot of things impact the ideas that come from the students. When we've had high school students here, right after the CSI TV shows came out, everybody wanted to be a forensic pathologist, and nobody wanted to be anything else. We had another fair, and we had somebody who said he wanted to be a pilot. And I said, well, what you really want to be is a flight surgeon, and then I'll see you walk on the moon the next time we go out that way, right? They've set their own boundaries based on their sense of what these jobs are. And I think we have an opportunity to try to open those windows up a bit. And so I think these programs are really good opportunities for us to do that. So, thank you.